we are talking about individuals, the most important thing about individual empowerment is the education. Knowledge is power. Education is power. When you have knowledgeable, educated individual, he will make a sound decision. So our job as a civil society organization is to provide them with the accurate, reliable information. Expertise, as I just mentioned in the previous slides, patients, they can be experts, especially if they have the right information, because this is the only thing they care about. It's a certain thing that they have, and they spend their time reading about it and becoming experts on that thing. Equality. This is very important. Both of us, we have to ensure the equality and to support the equality of the patients when it comes to the healthcare system. Organizational, we have several examples of organizational. We have the Saudi Patient Safety Center as an individual patient can work with to be the voice of the individual. We have the European Patient Forum. We have different organizations in every country. We have now over like 300 participants from different countries. The organization, either the national or the NGOs in the country, they are part of this experience, and they have to be the voice of their community and patients in their country. So this is part of the environment, and that's part of the empowerment that we are trying to work on. Policy, engagement. Patients need to be involved in designing more effective healthcare for all. They are part of the design of any policy. The patient-centered care. I'm sure this is a model you have seen, and this is a trend actually where the patient is the center. Everything revolves around the patient. When you have a mission, valid, aligned should be with the patient's goal. The care is collaborative, coordinated, and accessible. Physical comfort, emotional well-being are top priority in the healthcare system. And the three things here, it focuses on the family, the patient's family, where their viewpoints are respected and valued. They are the family, they are included in the decisions, they are aware of things happening, they are welcomed even in the healthcare setting, and there is full transparency and fast delivery of information. This is the model most healthcare centers have adopted this model. So patient empowerment is a healthcare model centered around the patient, developing the capacity to take responsibility for own health. This approach is most usually linked to people living with long-term conditions, and that's expected because if you empower the patient, they will take an active role in their life. So it will be easy for the healthcare providers just to follow with them, but they are actively taking care of their health. Now, the model has changed a bit from being a patient-centric healthcare system where the patient in the middle, now it becomes partnership. The patient not only in the middle, receiving the information unilateral, no, it's bilateral. We are partners. You are not in the middle as a patient and receiving all the orders. You are part of the team making a decision. And this is actually nice graph provided by the European Patient Forum, where actually they are promoting the empowerment of patients because it has several effects and several important and crucial factors for healthcare system. Empowered patients, they always make sound decisions about their treatment and care. They have better relationship with the healthcare professionals. They are committed to adhering to the treatment, to the medication, to everything because they own it. They feel they are in charge of their health. And they are willing to take more responsibility. If you ask them to do something extra, they will do it because now they are part of the decision. They take preventive measures also and seek earlier diagnosis, which of course will reduce hospitalization, emergency visits. It will increase also the patient safety. That's why we are together today. It's to have a zero harm and to increase the patient safety. All of the above, if we care about money, it will reduce the healthcare costs in the long run. And this is what we all strive for. So the patient empowerment is a high priority for healthcare policies. Talking about cost effectiveness, patient safety, everything, it's a high priority to empower patients in the right way. By increasing the role of patients, healthcare providers should become more responsive to patients' needs and preferences and deliver better quality care. Currently, sometimes we find some resistance from some healthcare providers. They don't like the patient to be empowered. They find it headache. But we will see today some examples. And hopefully you will change your mind if you are opponent to the patient empowerment. Patient empowerment, as I said, lead to less medical errors and increase the cost effectiveness of the healthcare. There are some fundamentals of patient empowerment. First of all, we have to understand the role of the patient. We have to identify the role of the patient, where the patient should fit, and where the patient should fill in. Health literacy, education is the core of any empowerment. If he's not educated, if he doesn't have the right information, this can be dangerous. Digital literacy, we live in the digital world. We are meeting today virtually. So that indicates how important is the digital literacy is very important, especially when it comes to empowerment, sharing knowledge, advocating for communities. Digital literacy is part of it. Coping skills, we have to teach the patients to empower them, coping skills and how to deal with their own diseases and problems. Respect, it should be granted for everyone. Shared decision making, they have to be part of the decision making. The presence of a facilitating environment. Civil society can empower patients. Every one of us can empower patients. But if the patient goes to the hospital and cannot find the system that supports his empowerment, then we failed. So that's why we need all to work together. Healthcare providers, NGOs, and also the infrastructure and the supportive system that allow this patient to practice its empowerment. Patient empowerment resources, and here I'm talking to the physicians and the healthcare providers. You always have to engage with your patient through different channels. Build a strong physician-patient relationship. Encourage your patients to get educated and take an active role of their health. And believe me, they will do it because you give them this ownership. Provide a list of trusted, authoritative online resources. Now we are in the era of misinformation, and misinformation using WhatsApp, TikTok, other different channels can be very dangerous. And we have seen it during COVID, where there conflict in information and patients, they just got confused. Healthcare providers with the accurate information, they have to be active and proactive and provide all the accurate information that's needed by their community. Patient empowerment resources, this is for the NGO. Engage with your community through different channels. You know your community better. You know the age of your community. If they are tech savvy, if they are old, if they are living in rural areas, try to reach out. Build a strong relationship by being the voice of your people. Advocacy. This is the core job of NGOs. Encourage your community to get educated and take an active role of their health. Provide activities and innovative programs to help them understand and access educational materials. That's what Tom Ferguson said, e-patients. Empowered patients. Who is the empowered patients? To wrap up this part, individuals who are equipped, enabled, empowered, and engaged. This is the empowered patient in their health and in the healthcare decision. Once we have this quality of empowered patients, that will lead us to the co-production. What is the co-production in healthcare? That's a poll. I want to ask you, how many of you have heard about the co-production in healthcare? Colleagues in the Saudi Patient Safety Center, if you can put up there you go. You have the poll. So everyone, please, we have 327 participants. If you can participate, if you have heard about the co-production in healthcare. Okay, 42 yes, 58 no. That's good, almost 50-50. So, what is the co-production in healthcare? Co-production in healthcare means the patients contribute to the provision of health services as partners of professional providers. So they are really partners of the healthcare system, of the hospital, of the management, of the protocol, of the decision-making process. They are partners in every step. The term co-production refers to a way of working where service providers and users, when I say service providers, it means healthcare providers, and users, which is the end user, which is the patient, work together to reach a collective outcome. And this is very interesting because the co-production, actually, it started in the 60s. It's not something new, and it's not specific for the healthcare system. It was there since the 60s, but it was mainly used in the industry, in the economy itself. It used to be, it started actually in the US, where they shifted from the industrial economy to service economy, where they shifted from providing a goodies and a product to shifting to caring about the customer and the customer care and the customer opinion. So they decided, whenever we are going to have a product, we will get the end user engaged with us to have the best product. So this is getting the end user engaged. So in the healthcare system, we adopted the same model. We said, okay, and instead of giving the patient the service, let's get the patient on board, let him design the service with us so he can enjoy it at the end. And this is the whole idea of co-production in healthcare. Also, it's been used in the aviation industry. Aviation industry is the best to minimize error and to increase safety. So they have been adopted so many models. One of them is the co-production, and I think it increased that safety and reducing the error. The approach is value-driven. Again, we care about the values, and by having the patient on board, we really care about the outcome and the service provided. It's pure value-driven service. It's built on the principle that those who are affected by a service are best placed to help design it. And that's the whole idea of co-production. This is a diagram that was published in 2016. It shows exactly what we are talking about. So we have the patients and we have the clinicians, or let's say the healthcare providers, and we have the critical infrastructure and tools to support the co-production. They all work together to come up with a service, innovative service, a good value service that can be used and utilized. And this is the whole idea of the co-production. What are the principles of co-production? When are we ready to do co-production and support the co-production in our organization? We need to recognize people as assets, and we need to invest in our own people and our own community, building on people's capability, developing two-way reciprocal relationship, patients, healthcare system, and physicians or healthcare providers, encouraging peer support. We're always supporting each other in this system, blurring boundaries between delivering and receiving services. Remember the core value of co-production. We have to include everyone. We have to be aware of differences in the community, of minorities. Everyone has to be represented. And this is the job of healthcare providers, and also the civil society organizations. Every ethnicity, every group in your community has to be represented in all of these steps. The current community empowerment methods by the non-government organization. What is the non-government organization? The World Bank, long time ago, defined the NGO as private organizations that pursue activities to relieve suffering, promote the interests of the poor, protect the environment, provide basic social services, or undertake community development. The NGOs now, they are having higher role than this. They are actually part of the community. They are part of other organizations. As you know, in any country, there are three sectors. There is the government, there is the private, and there is the non-government organizations. They are all equal, and they are all important, and they are all having different responsibilities that complement each other. And when it comes to patient safety, the NGO, they play a greater role because they are close to the community and they are the voice of the community. The World Bank defined it in different sectors. Today, we are going to focus on the NGOs and the healthcare as part of our webinar today. But again, the NGOs, they have bigger role. And again, they are independent from the government. So really, when it comes to empowering the community, they are independent and they have a voice in the ecosystem. NGOs, as I said, typically value-based organization. I love working personally in NGOs, and I know Osama shared the same thing. People working in the NGOs, they have this passion, and really they believe in the cause. So they are not regular employees. So really, when they are taking care of something, they are putting their hearts in it. And that's why I always believe that in any healthcare system, NGOs have to be involved. Has to be involved in things that does not need intervention, like surgical or something so complicated that the hospital and the healthcare system needs to take care of. When it comes to education, empowerment, working with the community, delivering important messages, vaccination, things that easy can be delivered by the NGO, I would give this responsibility to the NGO because they are the best to deliver these things as they are passionate and loving what they are doing. When it comes to the role of NGOs, NGOs play an instrumental role in global health. We have seen this during COVID, where the NGOs are taking care of so many things that happened. We are seeing it right now with the conflict happening in some countries, unfortunately. So the NGOs always, they are the active part in the community, humanitarian, they are just providing help and sharing knowledge with others and always there for other countries who are in need. NGOs master the community empowerment, priority setting, and advocacy that's translated to policy and improved health practices. One thing that I love about working in both government and non-government, working with the government, I do the research and do everything, but at the end of the day, you would love to see that translated to policy and improving health practices. And I think this is the job of every one of us. We go to work and we notice things. We have to be an active and help others who cannot do it on their own. And I think wherever we are, every one of us has this responsibility to help and identify the gaps and the needs in the community, especially in the low and middle income countries. Sometimes we put models, we put designs, that's the best practice, but sometimes it cannot happen that way. We have to survive with the minimums, and let's be creative and let's see what our community needs. And I promise you, after today's seminar, we will have a common ground. We will have an open discussion. We will share some materials and we can start collaboration and talking about how can we empower our community with the resources that we have. NGOs have contributed to the development of communities around the world, as I mentioned, are important partners of many governments, while remaining independent from the government, which is very important to be independent. I mentioned to you these fundamentals before, which is the fundamentals of patient empowerment. If you read them again, there are some can be done easily by the non-government organization. I don't have to assign it to healthcare providers in a hospital where another organization can do it for me, which is the NGO in the community. You are talking about understanding the role of the patient, health literacy, digital literacy, coping skills and training. These things, the NGOs are the best to do it. So just imagine in your healthcare system, if you assign things that's related to education, empowerment, training, first aid training, whatever, these things are or can be done by NGOs, while the hospital should work on something that cannot be done by the NGO. So you can complement each other and provide the optimum service to our community. Sometimes in the rural area, we have no option. We don't have a clinic. We don't have anything in that area. By empowering the patient, maybe through the digital literacy, through the telemedicine, through the virtual clinics, I think we can reach out and we can have an impact. NGOs usually, they are easier to have satellite offices to go around in the rural areas. So we need to capitalize on the systems and really utilize the NGOs in every way we can. Here is a beautiful example that I came across. It was published like 10 months ago, I believe. They shared some stories from India. 10 NGOs have revolutionized the healthcare in India. And these are like 10 NGOs. They have done incredible jobs. I'm sure in different countries, they have something similar. We need to spot them. We need to understand what they are doing, and we need to collaborate and cooperate with others. I will just give you some snapshot of the great things they are doing and just reflect if there is something that's happening in your country or something that need to happen. There are things like Doctors for You. It's healthcare professionals getting together with disaster management practitioners, social workers getting together to help others. There is the Rural Healthcare Foundation. As I mentioned, there are so many ways you can help the rural area and people in the rural area. Foundation for Mother and Child Health. I believe such an organization is very important and crucial to every community. We should have organization for mother and child. And if you don't have any in your country, please reach out, contact other countries where you can collaborate. Now it's easy to collaborate. Now it's easy to share programs. It's easy to send materials, packages, get funded from international funders and sponsors. We need to empower our community. We have to utilize our network and our wealth of information to empower community. Can Kids Can. It's amazing organization working with children with cancer. They are doing incredible job. Here is another humanitarian volunteer organization focuses on marginalized community. This is for youth and awareness. Again, education, education, education. Education is the key. And sometimes most of the materials on the net, it's in English or other language than your own language. So this is very important. And I will tap on this when I get to our experience in Saudi Arabia, where we lack the Arabic information, and reflect on your country. Do you really have all the content needed to empower your community? Because education is the core of any empowerment we are talking about today. Here is another organization and another movement. When we are talking about the patient safety movement, it's located in the States, I believe in California. It was established 10 years ago. They are doing an incredible job. They are actually focusing on the medical error and how to eliminate a medical error and reach zero preventable patient harm and death by 2030. It's a very ambitious goal, but really, patient safety, eliminating medical error. If you think about it, in any hospital, about 70% of any hospital is human, and error is human, as we all know. So the error is going to happen regardless. So when we have empowered patients, we will have another barrier that will reduce the error. So this is really our mission today, is to empower the patient to stop and eliminate the error as much as we can. The patient safety movement, actually, they love to collaborate. They love to collaborate with individuals, if you are interested, or countries. They have over 100 countries. They are working together, so they can use their programs and services. So this is something you can check it out. Now I will take you to the Saudi experience. We have a great experience in Saudi, and hopefully you will find it beneficial. So as you all know, the Vision 2030 started a few years ago. We had the National Transformation Program that was established in 2016. The aim of the transformation program was to develop the necessary infrastructure and create an environment that enable the public, the private, and the non-profit organization, which is the NGO, to achieve the Kingdom's Vision 2030. So basically, what we are talking about are all three sectors are equal. They are very important toward the vision. So this is the first empowerment of the non-government organization in Saudi. And we already felt that. If you look at the statistics these days, we are seeing more NGOs created just to keep up with the vision because it's part of the vision, and now they are fully supported. So today we have over almost 7,000 NGOs in Saudi. If you compare it to 2,500 in 2017, so the growth rate really is very high. And actually, we're expecting the NGOs to be more actually in coming years because it's part of the vision, and they are responsible actually to empower the community, and everyone will be on board toward achieving the Vision 2030. Then now I will talk to our organization, Rufaida Women's Health Organization, that was established in 2016. And I will tell you exactly why we established this women's health organization. I mentioned earlier, there is a lack of reliable Arabic language information on women's health, low level of awareness surrounding women's health among public and also the healthcare providers, absence of holistic view of women's health beyond gynecological health. People, they think women's health is a gynecological health, and that's not true. Lack of awareness about the rights and the laws that protect women in healthcare system. So one of our mandates is to promote women's health rights in Saudi Arabia. So Rufaida's core strategy, basically we focused on three things. We focused on education, utilizing all the social media platforms, including the website, including webinars, including newspaper, everything that you can disseminate information, we are utilizing it under the education. The second core strategy is training. We do on-ground training for certain topics that I will show you in the second slide. And advocacy. We are really big into advocacy. We are the voice of women in Saudi, especially women's health. So that's where we decided to lead the advocacy when it comes to women's health in Saudi. Here is the flagship projects that we have in Rufaida. I'm sharing it with you today for 3 reasons. One, just to share the current programs we have, and including the challenges. And also, I want you to see what kind of programs we have, and if you like it, we are willing to share. And the other thing is we need your feedback and we need your help. If you think there are things that we can provide or we can work together on, that would be perfect. And that would be really one of the objectives of today's webinar, is to exchange knowledge and to learn from each other. So I will go through the flagship project of Rufaida. The first thing under the education, we have the birth plan. So the birth plan project, it's basically working with a pregnant woman. As you all know, pregnancy is not a disease. It's a beautiful journey the women go through. So what we do, we have a digital form where a woman design her birth plan. This is logical. This is common in the US, for example, in advanced countries, but it's not in every country, and it was not in Saudi when we started this. So this is something I felt, or we felt, this is a woman should have. A woman should be informed. A woman should own her pregnancy, should understand every step. She should not expect surprises during this journey. It's not a scary journey, especially for the first child. We have to help women. We have to empower women through this journey. So we did this digital form where she comes in, where she designed her own birth plan, and we'll print it out. We'll go to her physician and discuss it. And every time she has a meeting or appointment with her physician, they will discuss it. So she's strong, she's informed, she knows exactly what she's getting into. Her husband will be involved as well. She decides who from her family side should be attending all these appointments or even the delivery dates. Any options she pick, she will get a pop-up for more details. So during this journey, she will be educated about the whole process. So this is one of the programs we are doing. The second one is the Unfiltered Talk. As the name implies, it's basically talking about women's health sensitive issues. Women, they like to get together, either in a coffee shop or a place where we have one expert coming in and answering their questions. Whatever questions they have, it's honest, private, they feel comfortable talking about any topic they like, and we provide them with all necessary things to have it as valuable as possible. So this is something that we do. During COVID, actually, we shift to online. We did Instagram Live. It was very successful, and I believe even men were joining, and we don't mind as long as they are getting the information. And the last one, you are entitled, it's human rights, which is a women's rights. With the Saudi now, with the legislative reform, and things are moving forward when it comes to women's health rights. Actually, we are working with the women to empower them and educate them about their own rights. So when she encounters something, we tell her, well, this is your right, you have to go and get it. And this is something we found it's very useful. And instead of going to healthcare providers, informing them about the rights, going to the patient themselves and empower them about their rights, it's easier because they will get their rights and they have the supporting documents that shows, well, it's not allowed or it's allowed. The second one is the training. Training, we have a puberty for girls from 9 to 13 years old. Again, it's a mother-daughter bonding time where we walk them through this new experience in their lives, give them cute packages just to understand. So this is kind of great programs that I'm sure low and middle income countries will enjoy, because kids' safety and kids' health is very important as well. And this is part of the journey that we have to invest in. Total control, this is actually it's an American program that we adopted in Saudi. It's about the pelvic floor dysfunction and incontinence. It's a 5 weeks workshop where women, they have to do training either in a gym. We are trying to be accessible, so they do it in a gym, they do it in gathering area where they get together and they do the exercises to promote their health, and also to stop the medical intervention, because with the incontinence, they need to go to have procedures, medical procedures, and sometimes it's easy to prevent that if it's not advanced. Know Your Body, it's a sexual health programs where we provide training, different topics, different target groups, sometimes before menopause, sometimes after menopause, sometimes after having a baby, before getting married. All of these, we have different programs designed for sexual health. Advocacy, which is my favorite part. We have the Women's Health Advocacy Forum. We do it every year, basically where we sit together with the policymakers, with the women from the community, and bringing up studies that shows we need to move forward with certain agenda. I will share with you one example was the HPV vaccine. We have been advocating for the HPV vaccine and mandating this vaccine, enrolling students during the school year in these programs. We started 2016. This year, March 2022, got approved, and now it's mandated in the school. So these kind of activities we are doing through the NGOs, basically. The second one in the advocacy is the women's health indicators. And this is very important for anyone in this webinar. Whenever you are developing a program or you are working with the community, you need to have data. You need to have indicators before you design anything for your community. You have to set up your priorities. You need to know your data and the baseline so you can measure your impact. Women's health indicators, it's a dashboard in our website where we see everything happening in women's health in Saudi, and also we compare it to the G20 countries, so we know exactly where we stand. And this is how we identify our top priorities that we need to develop programs and design something for those groups and that particular disease if it has to. Also, as the name implies, Rufaida Women's Health Organization, we focus on health, not diseases. So we are very proactive. We need to empower women to take an active role in their health, to focus on health, not diseases, and preventive medicine. The last thing is women's health research. I think we all agree that the healthcare system we are enjoying these days, it's based on men, not women. And that makes sense because the healthcare system who are in the clinical trials, men. So it was actually designed based on men, and all the symptoms recorded and the protocols and the management is based on men participants. Then a few years ago, when they started to see, well, different symptoms, the women, they are coming in with different symptoms, they are not responding to the same treatment, they have different autoimmune diseases, the STD infections affecting women different than men, the dosing also, especially with the mental health, the dosing is different. All of this emphasize the importance of women's health research. And in our organization, we promote women's health research to 3 different categories, let's say. First of all, to the researchers. Whenever you are doing research, you have to include male and female, ladies and men. When I say male and female, even if you are using cell lines, even if you are using animals, you have to use male and female whenever it's applicable. Okay, the funders, the funding agency, you don't fund any project that's not inclusive, that does not have male and female. That's something The Women's Health, the NIH in the US, they started 2016, and actually we are trying to push it here in Saudi Arabia. The same thing, you should not fund any project that's not inclusive. The third thing is women, because we are talking about women empowerment and women and patient empowerment. Women, they have to take an active role as well. Women, they should report anything that they feel. We have a reporting system in Saudi, but most of the time they don't report. They think it's normal or no one is listening. So this is something that we encourage women to do. And also we encourage women to be part of the research, to be part of the clinical trial, to show up, to be present. So these things are very important to have the optimum healthcare at the end. Here are some snapshots of things that we do in Rufaida. This is Houston Methodist, our partners. They provide lectures, webinars, the same one we are having now, for healthcare providers in Saudi Arabia, focusing on sexual and reproductive health. Here are some pictures of the total control program I told you about. It's about the pelvic health. So these are things that we do on ground. This is one of the sexual health workshops that we are doing as well. And this is the pregnancy, the birth plan, that it's online, digital. It's in Arabic though, but we are willing to translate if anyone is interested. And also, I have good news actually. This, the birth plan actually, it was award winner by the Saudi Patient Safety Center in 2019. So this is well-validated program. We have several centers in Saudi where we signed an agreement where we can transfer women so we can do our impact. Because in Rufaida, we really care about the impact. In any program we do the pre and post evaluation. So this is how we measure the impact of our programs and to decide if we should continue or not. Now, your job after sharing this experience, I believe you should analyze the current situation and set up your priority in your country. Identify the operational model. As I mentioned, there are so many models you can identify and you can see, but knowing your community and the target group you have, and I think you can develop a great model that fits your community. Involve your stakeholders when ready to design, implement, and evaluate your program. The mistake that's always made is the healthcare providers or the advocates, they will sit together, they will develop something, and they go out to the community to deliver or execute. And usually such a program will fail. Whenever you are designing something, part or like representative from your community, they have to be on board with you to design this program because they are part of the stakeholders. Learn from others, and that's why we are meeting today, to learn from each other and to share our experiences. Invest in your network, locally and internationally. Start your coalition. Whenever you have a good cause, sometimes it's easier to have a coalition, to have a stronger voice. Design interventions based on your own data and health priority. As I mentioned, you have to have your own data in order for you to design perfect programs for patient empowerment. Now let's talk about the challenges and lessons learned. As you all know, the burden of disease is high in the low and middle income country. Let's pick the STDs, for example. It's the highest burden of disease in the low and middle income countries. We are struggling with the vaccine equity, and we are struggling with reaching to these communities and stop spreading the diseases and the burden of diseases. This is one of the challenges that we are faced with. In some countries, NGOs are not empowered. So literally, when we say patient empowerment by NGOs, the NGOs themselves, they are not empowered. Therefore, they cannot empower their community. Healthcare provider resistance, and this is something we see all the time. They are not welcoming an empowered patient, and this is one of the challenges. Patient resistance. Sometimes the patient doesn't want to be empowered, and we have to respect that, and we have to deal with that. Patients, some of them, they are introverts. It's just like, I don't want to. We have to respect that, and we have to find a way how to deal with that patient and provide respect, of course, to him. Government can be a challenge. Social can be a challenge. Political things can be a challenge. Religion can be a challenge. Literacy can be a challenge. We have faced it as we are working on sexual transmitted infection and sexual education in a conservative society. It was not easy. You find challenges all the way. Sometimes designing a program for people in big city is completely different than designing a program for a rural area. Sometimes there is a social conflict. Sometimes there is a religious conflict. Sometimes you have minority that are not heard. So there are so many challenges in every community, and I believe every one of you have faced some of these challenges, and I think our role is to be inclusive and to have everyone on board and really to mitigate all these challenges with the best practice, just because our intention is to promote health and to provide the best health care for others and to have zero harm and to empower patients and to increase the patient safety in any practice that happens. There are things happening every day, everywhere. We hear it, and again, wearing the NGO hat, we are the voice of people, and we should always fight to mitigate all these challenges and just provide the service regardless of the religion, of the social status, of the literacy status, of anything. It's just providing the care for the patient. Here are some challenges that was published a while ago. Challenges to co-production itself. Sometimes there is unclear client role in the healthcare process, and you will see it most often. A patient coming in with information, he doesn't know where he fits in this co-production system. That's why you have to develop your own co-production system when the patient can join, who is in that group. Not everyone have the strength to communicate clearly with others and accept others. So in every organization, you have to have a good team that handling the co-production system, because you need to accept others, you need to collaborate with others. You are faced with different people, different background, all of these things. Not everyone capable of managing the co-production workload. So this is something that you need to find in your organization and you need to develop. So these are all the challenges, as you can see, when it comes to the co-production in the healthcare. Sometimes, how can you negotiate with the clients? Trust in the technical skills of the client. Sometimes we underestimate the patient. We think they don't know anything. Sometimes there is a communication barrier, different language, different dialect, different perspective. Developing rapport. Sometimes we need to develop this bond. We need to develop this good intention. We are here to work together. Okay, I think with good intention, always good things happen. Expectation of professionals and clients. Differences in philosophy and policy versus practicality. Some healthcare providers, they just want to deliver a service. They don't want to talk. They don't want to explain. They are so practical. And in these days, no, we have to listen to patients and we have to empower patients. And that's, in a nutshell, some of the challenges to co-production. Now we need to change the culture. We, as I said, empowered patients sometimes seen as a threat by some professionals, unfortunately. We need to view patients not as users and choosers, but as makers and shapers. We need to balance power. We need to change it. Professionals need to accept patient empowerment. We need to recognize patients as experts in their care. We need to focus on education, training, and communication, not for patients this time, but for professionals, for healthcare providers. We have Google syndrome that we should accept. We should not stop patients from Googling things, but we should teach them how to Google and how to find the accurate resources. Misinformation everywhere. And I think we have struggled during COVID with anti-vax movements. And this is something we have to understand. And sometimes fighting the misinformation is not just being reactive. It's just being available and providing the accurate information all the time. And that will be beneficial. We are all part of a community, and we will become a patient that one day. I think if we have this mindset, our views to the community and to empowering patients will be different, because we can be a patient one day. Again, as I mentioned before, you cannot empower a patient if the system is not functioning optimally. You cannot empower a patient, and when they go to the healthcare system, they cannot practice their empowerment. It's happened with us in our organization, where we empowered them about the HPV and the cervical screening. We have been doing campaign and advocating and everything, giving them all the materials. Then when they went to the hospital, they told them, well, we don't do it. We don't have it. We don't have the supplies for the vaccine. It's not approved by the FDA in Saudi Arabia. We don't have enough supplies. We don't have a cervical screening program. You are dismissed. And this is actually not right. When you empower patients, you want to be sure they practice their empowerment in the healthcare system. Future direction. Patients are the best information hunters, and we should capitalize on this. Know your community. As young they are computer savvy, so you have to be innovative. You need to utilize technology to empower patients, especially those who live in remote areas. Automation versus humanization. When we talk about the NGOs, we focus more on the humanization. We need to communicate with our community. We need to help hear from them. We need to use the automation based on their needs and their values. And so this is things that usually the NGOs play good in that part when it comes to humanization. People follow individuals, not centers. And I think this is common. It's common in Saudi. I'm sure in some parts of the world, it's the same thing. Patient empowerment, reduce medical error. And that's our goal with this lecture. The mindset will have to morph to involve all stakeholders to achieve zero harm and less medical errors. I will end with this story, which is the patient is the last barrier. You all remember the Swiss cheese model, where you have so many barriers, and sometimes you have things can pass through, and medical errors always pass through. But who is the last barrier? Usually is the patient, the empowered patients. So this is a beautiful lady. She said, when I read through my medical record, I noticed 2 mistakes. When I received the new glucose monitor, I noticed the readings were not right. I noted all the readings, comparing the old and new monitor. Finally, the nurses agreed there was a problem with the new brand of monitors. And that's what we always tell patients. Be vigilant, be aware. Don't think if they give you anything, it's right. Don't think using something new, it's better. Always be vigilant and compare. If it doesn't feel right, then it doesn't feel right. You have to speak up. And this is what she did. And beautifully, she said, if I can be working in partnership with clinician, I could have much more success at avoiding mistakes. Clinicians are full of good intentions and highly trained, but they are never going to be as committed to me and my health and well-being as I am. And this is actually what we are striving for. It's like to empower everyone to be an active, and we are all working together to prevent harm and to promote health. This is my last slide, and I would like to conclude with this. The health is the greatest human capital in any society. Therefore, community empowerment is a must to reach a prosperous society. Thank you, everyone.
Thank you so much, Dr. Fatma. What an inspiring presentation. I actually remember when the early days of Provider, when you first started founding it, and the ambitions and the plans and the strategies were something to be proud of. But for now, to see these policy changes you've made and these awards you've won, it's an inspiring story, and really glad to see this happening, and to be able to share this scope of lessons to the wider community. I see some hands raised in the attendees. I just would like to ask them to kindly write their question in the Q&A box, because we're due to the technical difficulty, we're not able to give the mic to anyone specifically. So I would like to help you arrange any questions and collect them and present them to Dr. Fatma. But let me first start with myself. I'd like to ask the first question, Dr. Fatma, if I may. In one of your slides, you mentioned the patient-centered model and how we're moving from that to the patient being a partner. But also there was a big emphasis, which I liked, on families, because we're not only including the patient themselves, we're also including their families as partners in care. And with that, I imagine, and what comes to mind is many experiences of NGOs working on caring for the carers, helping families know how to best assist their patient. If you can talk a bit more about the family of the patient, and how can NGOs empower not only the patient, but also through support groups, through whatever intervention that's available beyond the hospital, within the community. How can we support families and households in caring and making sure that the level of service and care is delivered to their patient, but also that they are not left behind and they're cared for?
Absolutely, this is very important point. And in any organization, especially the health organizations that focus on patients, we really care about the carers, the one who's taking care of a family member. And I know in the mental health society, they really have specific programs for the one who's taking care of a patient, because they are in need of help themselves. And I think this is a common practice. And sometimes the one who's taking care of someone, they suffer more than the patient themselves. And that's why they have specific programs, they have specific support. In Saudi, we have a support group where they get together and share experience, and they share some strength. Because sometimes when you get together with in a support group with others who are going through the same journey as you are, it helps you, it enlightens you, it gives you more strength to carry through the whole experience. And it's part of the journey. I know in some hospitals, in King Faisal Hospital, the patients and their families, they are well supported. Also the NGOs. Here in our hospital, there are satellite offices for the NGOs to take care of the patients and their families as well. In Saudi, as you know, we are family driven. Family is everything. And also at the same time, we care about the patient's consent to this relation, because working in a women's organization, sometimes the woman, she doesn't want her family to be involved. And this is the hardest things to do, but we should respect. When it comes to the birth plan I mentioned, there are some ladies, she said, I don't want my husband to come with me during the delivery. This is her choice. So what we do, we provide the support that fits the patient. Regardless, we agree, we disagree, it's just our focus is just to help and to support and to respect different opinions. And this is something we have encountered during our work.
Very nice. Thank you so much, Dr. Fatma. Another part of the presentation, you talked about coalitions and networks and how NGOs can learn from others and how they can tap into resources that are available regionally, globally, and learn from sister organizations that are working on the same field. Talk a little bit about Rufaida. What kind of coalitions are you thinking about joining, or networks, or role models you're following, or sister organizations you're learning from, and how you tapped into the networking element?
Excellent. So we are so grateful for King Khalid Foundation, because we were incubated by King Khalid Foundation as the big sister in Saudi Arabia for 4 years. So that's how we started our own organization, with this big incubation program that makes us stronger. As we emerged from this incubation period in an NGO in Saudi Arabia, we collaborated with Houston Methodists in the US. Now we have current collaboration with the UNDP. There is some communication with programs in Afghanistan, where they want some of our programs to be implemented there. We have also ongoing collaboration with HAF, which is another NGO that works with Gates and Melinda organization or foundation. As you know, Melinda Foundation, now they're supporting the women's health and reproductive health. So there is ongoing talk how to work together to support women in low and middle income countries. That's why I went through Rufaida's programs in details today, is just to show it to everyone that this is what we have. If you are interested, we can share with you as well. If you have something similar or something better, let us know so we can adopt your model and we can share the materials. And this is how the impact will be greater. I think at the end of the day, as an NGO, you want to make an impact, a greater impact. And if there is a way we do it, why not?
Exactly. That's exactly what we need to see. Another question from the audience is about the concerns among healthcare professionals around community empowerment. There is no specific concern shared here, but I would assume that maybe sometimes you mentioned some of the risks and the barriers, but maybe information that is well intended from the community could be misinformed. The concern that the audience is the attendee is speaking to directly is about medical issues and litigation of health workers, taking underdeveloped countries into consideration. What is your suggestion? So probably the issue is around legal risk to health professionals. Please give us your thoughts on that, Dr. Fatma.
I'm not sure if I understand the question very well. So the question is there any legal consequences if you collaborate with a patient, empowered patients to develop something? Is that the question?
Maybe that, and also working with NGOs. Maybe the NGO is not going to share the legal risk, I suppose.
Yes, yes, that's a very important question because it's very clear that every country is different, and what is the legal form? I think in any organization, at least in Saudi, we are working together with NGOs. So in order for us, let's say the birth plan, we got an approval from the government to have it used. So I think in any programs you have, in any collaboration you have, there should be an agreement. As I mentioned, sometimes the NGOs, they empower patients, but when the patients go to the hospital, they cannot practice their empowerment. And this is one of the challenges we have. And I think the best way to do it is the NGOs should work closely with the hospitals to provide the best and the fastest service that's approved by the hospital, because otherwise the NGO work is wasted because they empower patients. The patients cannot practice their empowerment, then that's a waste. So this is something I think that needs to be tackled even before the empowerment takes place.
Definitely, and as you said, Dr. Palma, it's different from country to country. I know, as you mentioned, Saudi Arabia, we have technical supervision from the Ministry of Health over the activities of health related NGOs, so they're legally supervised, and most likely anyone who's working on giving medical advice is should be certified and from the legal authorities in the country. Another question is about the role of NGOs, maybe the mature ones, as they grow, and not only advocating their country and their government, but also global health and global advocacy. I know you've been engaged in international settings on multiple occasions. And if you can tell me, what can NGOs bring to the international table that is different from government delegations, different from health companies, different from health practitioners? What can NGOs bring to international diplomacy?
Absolutely, the NGOs, they have a very important role when it comes to the international presence. The NGOs, they are the trusted entity in any country. Usually during the meetings, yearly meetings that takes place in some countries, NGOs, they go with the shadow reports of the activities that are taking place in that country. And they are well trusted. Maybe I mentioned it several times that the NGOs have to be independent. They have to be independent from the government, because they have to have, in order for them to have a stronger voice, they have to be independent. Otherwise, they are a government as well. So that's why the empowerment of NGO themselves, very important, because that's where they weigh in when it comes to international presence, diplomacy, the moving agenda, talking about, in our case, women's health rights, for example. You have to be independent and your voice will be heard. And that's where you have your baseline, that's where you have your data, that's where you have your numbers, because you provide it as a separate report.
Very clear. Another question is about NGOs, and a specific type of NGOs is called patient NGOs, but sometimes we're talking about NGOs that work on areas like women health. Do you recommend, or do you have any experience to share around involving patients in designing the projects with the NGO, involving patients to the board of the NGO, to the leadership of the NGO, to the membership, to guide the activities of the NGOs? I know patient empowerment is not limited to the hospital settings or when it comes to their own health decisions, but when it comes to the NGO, to what extent do you recommend involving patients in the NGO operations?
Absolutely. Involving the patients or community members in the NGO is a must, actually. It's I cannot imagine we design any programs or even the strategy of our organization without having someone from the community on board. As you know, when we design our strategy, we have focus groups. When we have our general meetings, general assembly meetings, the board meetings, always the voice of the beneficiaries or the patients is there. We didn't develop any program without having a patient on board or a woman from the community on board, even men. We serve them both. So you cannot really design anything without having them on board. And I have seen some programs that failed because the NGO, they will sit together, develop something, and they go out to execute, and they fail because it's not the right time, it's not the right product, it's just, we didn't ask you for this, we wanted something different. So that's why the easiest way and the efficient way is to have them on board from the beginning before you design anything. And they are part of your stakeholders. As much as you care about the board, as much as you care about the sponsors, the funder, you should care about your beneficiaries, and they have to be all sitting at the same table.
Excellent. This is exactly the model we would like to see replicated everywhere. I see some attendees are excited about working with Rufaida. Some of them are asking about how do we collaborate with Rufaida in a maternity hospital. Do you have any contacts information, any websites you'd like to refer people to be in touch with you?
Yes, of course. I will type our website, and of course the Saudi Patient Safety Center, they have all the details, so you can reach out anytime, and we would love to collaborate.
Excellent. I just noticed from your earlier answer, you mentioned the satellite offices of NGOs within King Faisal Hospital. I think this is a unique experience. Can you talk to us more about it? Because many NGOs are worried about the idea of them working with patients to go to the hospital, but doctors are not referring enough patients to the organizations or to the NGOs. In your experience and in the experience you're familiar with, how does referral work from doctor to NGO, and how do NGOs operate within hospitals, especially in the case of satellite offices?
Very good. So I will talk about King Faisal Specialist Hospital. It's a tertiary care hospital. It's a referral hospital in Saudi Arabia. So we have patients coming from all over to Riyadh, which is the capital of Saudi Arabia. So we have the Saudi Cancer Society satellite office inside the hospital, and they are doing something very beautiful. What they do is they support the low-income families coming from the south or coming from the north. So they have the satellite office, and these patients coming in, they will send the transportation to receive them from the airport. They will have a hotel for them. They will receive them to get in the hospital. They will give them the support, the all kinds of support, the emotional support, the financial support they need during this hardship time in their lives. Okay, so this is the Cancer Association, financially supporting the patient and their families to facilitate the whole process. We have another satellite office. It's for the breast cancer, Zahra. Zahra, it's a breast cancer association that they have a satellite office. They have the wigs, they have the makeup, they have the consultation, they have the support group. So for women having cancer and getting the news of having a breast cancer, they go to the satellite office and they get all the support they need. They get all the information, they get all the help, and sometimes they translate to them because, you know, sometimes the language is another thing in a bigger hospitals where not everyone speaks Arabic or not everyone speaks English. So these kind of two examples that I'm proud of and see it all the time. And that's where the healthcare providers, they will say, okay, if you want support, go to this organization. If you want financial support, go to that organization. Well, if you are you need just this certain type, I know this organization. And that's how or what it should be actually, the healthcare providers, they have to be aware of what kind of support they have in their society, because the government or the healthcare providers cannot do everything themselves. That's why we have this supportive system. That's why we have the NGOs. NGOs driven by good values, NGOs driven by good intention, by donors, by people who would love to help. So I think being all in that circle and being aware of what's happening in our community, we can direct our patients and we can empower everyone in that community for a better life.
Very nice. This is very critical, even though it seems like logistical help and logistical support, but it means life and death to these families and these patients to be able to reach care, to be able to fly to the hospital, to be able to find shelter and housing and advice and these types of services. I just wonder if you have any idea on how much do donors believe in the role of NGOs? Are they more channeling their funding to poverty fighting NGOs, to orphanages, and maybe other social areas? Or is there an appetite to support these kinds of services and these kinds of NGOs? How much do health-related NGOs get in terms of support from individual donors and grant-making foundations compared to the other areas of interest, if you have any idea?
Yes, absolutely. When we started our women's health organization, people usually, they don't donate and they don't support health. They support disease. If you bring a patient having cancer, they would support cancer patients, not women's health. This is something that we faced in the beginning, and sometimes for religious reasons, they think supporting orphanage, supporting kids has more value than supporting women's health, for example. But as we progressed and as people saw the products we are serving, as people think about the quality of life and we are in the era of preventive medicine. If you think about health, is more important that we should invest in rather than diseases, and investing in healthcare and how to treat diseases. We should prevent the diseases before anything, and that's our actually work, is to promote health, not diseases, and we don't want women to reach to that. And we believe by having a healthy woman, you will have a healthy family, an educated family. So little by little, we gained actually trust, and we are getting support. And as things moving forward in Saudi Arabia with the transformation, with the new vision, we are getting more support. Even we got a fund from Boeing, from the aviation company, and because they started to hire women in the workplace, and they wanted us to teach women in the working place and to promote women's health in their working place. So they supported us for 2 years with a great fund. And this is an example. It's like if they see the profit, if they see the benefits, they will support it. And also, I think having a healthy lifestyle, having a healthy work environment is beneficial for everyone. And I think this is what we are trying to promote. It's like, let's invest in our health. Our health is our wealth. If your employees are healthy, let's support everyone. And I think this is the motto that we are getting into these days. And we gain trust actually from different organizations. We are receiving funds from others, and again, it's about the quality of the programs that you produce. And once you have your name out there and the quality you produce, it will be easy to get funds.
Very nice. Very nice to see this confidence growing among stakeholders in North. Maybe we're almost out of time. I just have one last question about education and awareness. You mentioned a huge role for NGOs on that sphere. And you mentioned also the risk of misinformation that we need to tackle. But also many of the current, let's say, projects focus on digital awareness and digital campaigns and digital presence. But since this type of webinar is targeting low income and middle income countries who maybe have lower accessibility to internet and lower accessibility to digital services, do you have anything to say about presence in the community, in the malls, on the streets, any types of non-digital awareness that NGOs can take?
Of course, you know, when it comes to awareness, there are different programs and there are different approaches that everyone can do, because once you know your community very well, you can develop a program. And this is, I emphasized several times, because what we used to do in Saudi, we used to go to the malls, we used to handle pamphlets and things that had information, but we didn't find it beneficial. We didn't find it useful. They just take it and throw it. And so this is a waste of resources. We found people that are into technical things. They are into WhatsApp, they are into TikTok and other things. So that works for us. It's cheaper when we talk about financial part, and at the same time, the reach is higher. So sometimes a video can reach millions of individuals, and that's where your message can come across. But I do understand that the internet is not available in every part of your community and country. I think having going to the local school, going to the universities, going to the gathering group, the malls, and sometimes the religious places is the best place to go and share your core messages, share your important messages that you want everyone to go. I know in the US, sometimes they say they go to some malls or places where people get together and they share their messages, and they found it beneficial. For example, in certain communities, they said they like to hang out there, so they always go there and share their messages. I know in Saudi, sometimes the Friday prayer is the best time to do it. You come in with your message and you share it with them, and everyone will go home and will say, okay, well, today we discussed this, I knew something new. And this is how to be creative. The football game, you can share your message. So again, it has to be creative and captivating, because people, if they get the message right, they will help you to spread the word. And that's where you have to be creative and not boring with the information you share.
Thank you so much, Dr. Fatma. Very practical recommendations and tips. And I'd like to thank you for your time. I'd like to thank the organizers and 350 participants that joined us throughout this session. I'm sure we learned a lot. We have a lot to take home and process and hopefully translate into actions within our communities. Thank you so much for everyone who joined us today. With that, we end our webinar today, and we hope you all have a wonderful evening. Thank you so much, Dr. Fatma. Goodbye, everyone.
Thank you, Osama, and stay safe, everyone. Thank you.